Hello and welcome to another episode of Younger by the Minute. I'm your host, Jamie Spicer, and I'm always here with my other half.
I'm Jennifer Spicer, and I'm super excited today because we have an incredible special guest, a physician whose reputation is rooted in science, safety, and innovation. Dr. Daniel Suissa is a board certified plastic surgeon, known not only for his surgical skill, but for his deep commitment to evidence based aesthetic medicine. With advanced training in clinical epidemiology, he brings a level of scientific rigor that is rare in our industry, and it is rare. What truly sets Dr. Suissa apart is that he blends data, artistry, and patient education. He's an active researcher, a peer reviewer for the top medical journals, and the mind behind transformative approaches to body contouring, which includes his world renowned new technique called Soft Sculpt, which I'll let him get into. But from how training and nutrition can augment surgical outcomes to the rise of minimally invasive body shaping to how his patients can make safe, informed decisions in a world full of noise, Dr. Suissa brings the kind of conversation we love: science first, honest, transparent, and patient centered second. Welcome to the show. We are honored to have you.
Welcome.
Thank you, Jennifer, Jamie. Wow, what a glowing introduction. Now you can tell the listeners about me.
No, I'd
I'm
like
like, who
you
is
to.
that guy? That's crazy.
Well, and like I said before we joined, we had already heard of you. So it was funny when we got, connected. I was like, this can't be real. So
Yeah.
I'm very excited to talk to you and
Same
just
here.
learn more about you.
Same here. You guys are amazing. Your podcast is amazing. I've listened to a bunch of it recently, and it's really, really nice. I'm
Thank
happy to
you.
be here.
We
Well, thank
appreciate
you.
that.
And the next time we're down in Florida, we're going to have to come see you.
Right?
Please do.
Yeah.
Please do. We love visitors.
Yeah. So I guess we'll just start basic. We'll just kind of get like how and why did you get into plastic surgery?
Oh yeah, that's like that's the interview question. When
Right.
you're applying for the program, it's a tough one. Everybody kind of that's probably the question that everybody when you're young, you're not even a surgeon yet, you're just trying to get in, and it's so competitive, and you think about that question, and it's so easy to fall into the trap of giving like fake answers, that sound really, really good for an interviewer. And but I think the truth is, and I've answered this question before, and I think this is, the honest truth, is that part of it was I was exposed to, medicine heavily through my father, who's a, big medical researcher, gives talks around the world. And so I always talk about him, big shoes to fill. And I was exposed to him, to his colleagues. We always had guests. My parents are very sociable people. So a lot of people would come and sit at our tables, and it was just an incredible experience. And I fell in love with all the things I was hearing and the amazing stories. And so I was kind of pretty young when I started realizing medicine. And then I always knew I was good with my hands, always tinkering, fixing stuff, taking things apart, sometimes not being able to put them back together, but I guess that's part of it, right? And then I just slowly kind of found my way and started realizing, oh wow, plastics. And I'm not going to lie, there were some shows on TV that and I have the privilege of working with one of the greats in our LA office, Dr. Robert Ray, the original Dr. 90210,
Right.
an absolute legend. And I'm naming him right now. And we have a bunch of other incredible surgeons, but he was, the original on TV, one of the first who made cosmetic surgery, I think, a big part of it, what it is today, popularized it, maybe even made people more comfortable with the idea of slowly talking about it, and it's taken a long time, but I think a lot of the taboos have fallen or they're continuing to fall. And I think that's a good thing because people shouldn't be ashamed. And so I'm kind of going a bit off topic, but I think it all comes back to that same idea that you kind of see something that's fascinating, you think you're going to be good at it, and then you're exposed through many different channels, including TV, and that's the truth. Maybe not a popular answer for an interview question, but it's the truth. And I think it was a great match. I love it. I think it's fascinating. Um, I want to do more of it. It's just it's an amazing thing. I've had the chance to play around with technologies, developing technologies too. That's been fun. And so I think it's an incredible specialty. I think medicine it's a privilege to be able to practice it, and cosmetic plastic surgery is very fun. So I'm
Yeah.
blessed.
I love that. I know it, like you said, it's a basic question, but I love how you answered that because, I can relate to so many people that I've talked to is like, I got into it because I liked at first, what got me into it was I used to like fixing cars and then I started fixing people. But,
Yeah.
you brought up TV shows and it just brought me back to like the early 80s, late 80s fitness shows. And always used to watch them, because for me growing up, I was put into a bodybuilding gym when I was 13, and I just always strived. Like I wanted, when I get older, that's how I want to look. And so
Yeah.
that's what kind of drove me into it. So kind of like you said, like, what's my answer? So when I answer that, it seems generic, but it is raw, it's honest, and it's very truthful. So I loved your answer. I think it was great. And thank you for bringing me down memory lane with the old 80s
Love that.
fitness
Love that.
shows.
Well,
Those
and
were good years.
Yes.
Good years, the 80s.
I think it also speaks volumes to your passion because, as you mentioned in the beginning, say you wanted to be a plastic surgeon, that doesn't mean that that's where you're going to end up because it is very competitive. And I don't know if everybody knows that, right? Like you have your path, but it depends on where you're going to get your fellowship and residency and what they're going to let you
True.
do.
Yep.
So it's hard, and you have to be passionate about something that's hard because I believe that you have the longest fellowship and residency besides neurology, correct?
It's long.
Yeah.
I mean,
It's fine.
at that point, I don't think you're competing anymore. It's more like surviving.
Right.
Right,
But
like who's cut out.
it's like mine's longer. It's more like, are you okay, man? Are you okay? Like it's a different, but we're all in it together kind of thing in the trenches. Residency is, it's tough and it's a rite of passage. And I believe in it, even though it was tough. I believe in it. I think it makes us the surgeons that we are.
100%, because that is something like we talked about the noise in the aesthetic industry, and I've been in it now since 2004, and there's so much noise, and there needs to be change. And this is not what this podcast is about, but in how, the mid-levels and the other providers do their work. So I hear you there because we need more of that from everybody else that's in doing different types of aesthetic medicine in general. How
Yeah.
how do you think also having clinical training in epidemiology plays into you as a plastic surgeon?
I think it's great. I mean, that also came from being exposed, right? That's what my father does. He's the world-renowned epidemiologist, teaches all over, gives talks all over. He's been on boards of huge pharmaceutical companies, for expertise. And so I mean, I realized the value of that very early. And the other thing I realized is it wasn't as common, especially when I was doing it and I decided to pursue that. It wasn't as common in surgery. I think now there's more and more of that trend to kind of understand research better. There's a bit more of that, which is great, which is so important because ultimately there is an incredible amount of medical research being put out. It's
Mhm.
it's crazy, right?
Yeah.
And there's all kinds of issues with it. I mean, first of all, the pressure to publish. If you don't publish, you'll never get tenure. If you don't publish, you won't be able to be a professor in this university. If you don't publish, you're not going to get grants and funds. So there's a lot of pressure to publish, and unfortunately, that leads to sometimes I'm not saying this intentional, right? It's not intentional, but it leads to more mistakes. And when you get a lot of different types of studies, some good, some average, some bad, you need to know how to differentiate. You need to know how to read them to understand, okay, this is high quality research. This is not bad, but I have to take it with a grain of salt, and this is trash, right?
Right.
And everything in between those categories. But it's on a gradient, and the better you understand that gradient, the better you can adjust your practice and you can adjust everything you do in medicine for your patients based on what's really good research versus anything that comes across my desk, because you could be reading and reading and reading, and it could be a lot of stuff that you should not be changing your practice or adjusting in your practice or applying to your patients. It's and that requires a certain expertise, and I only have a master's degree in this, but you can go on, PhDs, postdocs, lifetimes of
Mhm.
mastering this. But at least I have the basis to understand good versus bad research, so that helps a lot.
Well, and I think it also speaks volumes to how you were able to create your soft sculpt because you have been taught with in a way that makes you want to analyze so you can discern things. So it's all about how you can even make a micro adjustment to bring in a better result, to yield a better patient outcome. And that is also something that's very much needed in the world of aesthetic medicine, because you said it very well. Like, now we have more people doing injectables, more people doing surgeries, more people doing liposuction that aren't even plastic surgeons, and they really don't have the good basis or the good foundation underneath them, and it is creating some issues. And I think that's where people don't always know what they're getting when they go into an office. So I think it really helps to augment what you already do very well, and I think that's probably what sets you apart.
I mean, listen, I try. Ultimately, this is all for the patients, right? Anything we do, and it always starts with, I mean, aesthetic result is a given. You have to, and you have to do your best, and you have to prepare people mentally in terms of expectations. Never overpromise, right? It's more like underpromise, overdeliver. But safety comes number one. Safety is an obsession. In fact, honestly, like people who know me well would be saying, yeah, safety, everything is an obsession, right? So like
Mm.
how I make coffee in the morning is an obsession. Like I go down the rabbit hole for everything, everything has to be perfect, everything has to be optimized.
Guilty.
So obviously you can imagine, oh, there we go, a connoisseur over there. So,
Yeah.
but I mean, if I imagine if I do that for coffee, what I'm gonna do for my patients, like it's a bit of an obsession, and sometimes you realize I need to do this, I should have done that. But it's a constant struggle to improve and do better and better and better, and never stop and think like, okay, I have it figured out, because we don't.
No.
Medicine evolves constantly.
Yeah, and that even applies to life, and I just think that some of us are wired a little bit differently, and, I always say that for every, personality trait that is a benefit, so, like, being a perfectionist is good, you're gonna be very detail-oriented, but it's also reeling it in on the other side to make sure, where it bleeds into doesn't end up biting us,
Your couple.
yeah.
All right.
I get that. So I would love to hear more about the soft sculpt technique and what that is and how you came to, start to do it.
Yeah, I mean, listen, you got to put a name on something if you're going to do something a little different. Um, I would say, the truth is, and I use this example a lot, uh, Tesla didn't invent the car. They didn't invent the car, but they didn't even invent the electric vehicle, right? They didn't. It was invented in the 70s.
Right.
What they did is they improved on something that was already there, and they pushed forward an idea against all odds. And even though the world said we weren't ready for it, and they kept pushing and pushing, and it was a bit of an obsession, and sleeping on the floor at the manufacturing plant. Listen, love the guy, hate the guy. I'm not talking politics here, right? But in terms of pushing something forward and at least believing that we're having a huge impact on the world, I think that's what it's about, right? I mean, are we right? Are we wrong? The batteries, this, I don't know, man. But I know that somebody with good intentions who pushes something forward and does his best to make a positive impact, we need more of that, you
Yep.
know? And so that's kind of how I see it. I am I perfect? Have I never made? Of course not. I mean, it's we learn, unfortunately, from our mistakes. We try to also learn from the mistakes of others, which sounds cliche, but it's the truth. It takes years to realize that, because we don't know that when we're teenagers. So I think I I do you do the absolute best you can, and you always push it forward, and it always has to be with your heart in the right place, I think. And I think that's the key. It can't be about money, it can't be about success, it can't be about visibility or fame. It can't be. Those things need to be out of the picture. It needs to be about, the patient. It needs to be about doing the right thing. It needs to be about safety, about, caring, about empathy. We're doctors before anything else. That's the oath we take. So does that answer your question? I know
Yeah.
kind of, it's a bit broad, but
Well, no, I actually loved it because it did veer off, but it's actually what I think everybody needs to hear, because I don't think that a lot of people do take that oath. Some people do have the wrong intention in mind, and you're right. If you do things with a good outlook and your moral compass aligned with whatever faith you believe in, and just do it, and you just keep pushing, you will end up getting there, and sometimes it can be hard, and that's what has to keep you going. In
yes.
regards to the treatment,
Yeah,
you know, how
specifically.
yes,
Yeah.
how do you
Yeah.
do it?
Listen, specifically, I think that's kind of what I was trying to say. Maybe I'll just go a little more precise here, but basically, we just kind of, everything is progression, everything is little steps. We didn't invent the car, we didn't invent the wheel, we didn't invent the electric vehicle, we didn't invent awake liposuction, we didn't invent liposuction, we didn't invent, right? What we do is we take what's there and we make it better, and we try to make it better, and we do it with our heart in the right place, and we you improve the technology a little bit, right? So we have a bunch of patents for a handpiece that I think is a little bit better for the patient, a little bit safer, a little bit better for the surgeon's experience, which usually makes it better for the patient. So, like, the surgeon feels the vibrations less in their hand and arms, which makes it more comfortable, also safer, because you can get nerve damage from those vibrations. If it's safer and more comfortable, well, he's going to be less fatigued and do a better job for the patient. If the vibrations are a little bit faster, well, the patient will be a little bit more comfortable. Something I've spoken about a lot. It's the gateway theory for pain, right? Those
Mhm.
Right.
vibrations confuse the brain, and the patient is more comfortable. If we take the little tube that brings the numbing fluid, the tumescent fluid, to the patient, and we integrate it into the handpiece, well, then that's one less tube that's floating around that can catch bacteria. So you reduce the risk of infection a little bit. And so everything is, we eliminate the plastic from the fat canister, and we custom make one that's patented with glass and stainless steel and all materials that don't leach microplastics into the patient's fat, because those are going to be re-injected. So everything is thought out, little details. Did we reinvent the wheel? No, but we try to improve it, one little advancement at a time, and make the patient, more comfortable, make it safer for the patient, make it better for the surgeon, and just try to, bring the specialty forward. And if everybody does a little contribution like this here and there, I think we get there. In terms of the techniques, it's the same thing. So that was the technology. I think it's easier, more concrete to explain. Whereas with techniques, without the expertise, it's kind of hard. But little examples like things that will protect the holes that we make, right? Because you make
Mhm.
those holes, you put the cannula in. We don't make big scars; they're tiny little holes. But those holes, with the rubbing of the cannula going back and forth, it can cause little burns. It could cause scars that should be smaller are a little bit bigger, and we want to avoid those. So how do we improve that, right?
That
Different things that we do to the cannulas, different protections we put around the skin, different. So there's always little tiny improvements that will make it so that the whole thing is different, even though it's really just an evolution of this. We kind of left from the same place, but all those tiny little tweaks, they amount to something that I think overall is better, right?
W-
And at
Yeah.
least
Well,
that's my opinion.
as someone who's had liposuction and has a less than desirable outcome from all the things that you mentioned that you got away from, cannula was too large,
Mm,
placement of, the incision sites were a little bit too big, all those things.
yeah.
I feel like a lot of patients or listeners might not understand, like, you are able to really sculpt the body without needles or stitches, and you can really, really contour someone's figure, and they don't even have to go under general anesthesia because it's comfortable. And then you're taking all these steps to make sure that they're not getting any infection as well. And it's huge.
Mhm.
It's
Yeah.
huge.
Yeah.
And even
For
get
the
away from the
reader, yeah.
plastics, get away from the plastics and everything else like that, because
Right.
that's going to cause inflammation,
Mhm.
which is going to
Yep.
impact recovery time, which is going to impact desired outcome. Yeah,
Yeah.
those are, as you say, they're little steps, but just like in surgery, just a 2 millimeter incision, or just like anything like Tony Robbins talks about, just a 2 millimeter shift can generate a big outcome.
Yep.
It does. It does. It
And
makes a big difference. Yeah.
you just have less downtime and more comfort. And like you said, you're actually giving yourself and those that do this more precision. And I think that's also a very big thing because some of that equipment's really heavy, you
Yeah.
know?
Yeah. Yeah. Let me backtrack for the readers a bit, because you're right. We talk about this there's a lot of people who might be wondering, like, wait, what are they talking about here? So let me kind of backtrack just a bit and say, okay, so what we do, right? We do liposuction. We do it with very small instruments, and we use techniques that permit us to do it awake. No tube down your throat, no anesthesiologist pumping air into your lungs. No, you're awake. You're moving around. Some people nap sometimes. They feel comfortable and they'll nap. Some people get ticklish from the vibration. I've seen people laugh. People sometimes laugh a lot, because one of the things that we use is laughing gas, nitrous.
Mhm.
And I always tell them to take a big hit before I make a joke, and that always works very well for me. And so, we keep it fun, we keep it light, and it's safer than general anesthesia. General anesthesia comes with risks. When you
Yep.
need it, you need it. You're getting heart surgery, you're getting whatever it is, you need it. You have no choice. It's important. It has changed medicine. I am not anti-anesthesia at all. Thank God for anesthesia. But if you can avoid it, like in our case, well, then the patient gets to move around. They're more active. They avoid those blood clots that you get from not moving around. And the recovery is better because you were not knocked out for several hours. You're breathing on your own, and people just feel less down than they do. Those meds have a tendency to put people down for sometimes a few days, sometimes a week. And that's a critical period where you want to be moving. Our patients are walking around. So these are all little things that kind of play in, and then we take that fat, we process it like we were saying with those glass canisters, a bunch of patented technology to make it clean and safe, and we use that fat and re-inject it into a woman's breast for a natural augmentation that we call naturals, that we've trademarked, or BBL, and that depends on the body shape, but adding some fat to the butt or the hip tips to try and give that nice hourglass shape, always done with a very natural look. We don't do anything that's very extreme. We try to do something that's timeless and that's not trendy, like very big or very thin. We try to stay in something that these proportions that have universally been accepted as attractive to the eye, and that's kind of how we keep things, safe and comfortable and fun and long lasting. And fat is great. Fat is great. You already have it. Why throw it out? It lives with you forever. People think it melts away. It doesn't melt away. You lose about 30% that the body reabsorbs. That's at the beginning. And then whatever is left at a month about is permanent. And that's yours. And if you gain weight, it gains weight with you. And if you lose weight, it loses weight with you. The holes to put that fat in are tiny. It's not like a scar you would have from breast implants. So there's no implant to feel. It feels super natural. I mean, surgeons get fooled, right? If you miss that tiny little hole and you touch breast like that, I feel like breast. 70-80% of a breast is fat anyways. So we're just adding more of that. So same thing for the butt. So it's a great procedure. I mean, I kind of veered towards it because I touched on a bunch of different things and I realized, wow, this is fun, safe. I can do it awake. I think I can improve it, even if it's a little bit. And it's fun, and you get to interact with the patients. And like I said, sometimes we get some good laughs, and it's just a great procedure. Or I
You
wouldn't do
said,
it.
well, and I love that. And I love your morals and ethics because there's a lot of fads out there, and you're keeping true to what the integrity of what aesthetics means. Aesthetics is balance, aesthetics is symmetry, aesthetics is as much as we can. And so I really, really do like that because you can get caught into the trap where people are a little bit proportionally distorted, and it's just not the best for the patient long term. Because look at even the Kardashians, I think they're even smaller now, so like they had
Reversing.
this,
Yeah.
I think they're under a sixth look.
no, but
Yeah.
it's really true. And
That's
since COVID for me as an injector, and I have stopped using a lot of injectables. I try to keep it extremely regenerative, whether it's using PRF. Obviously, I can't harvest and re-inject fat in my practice, but I've thought about that because the long-term, risk versus benefit with patients as mast cell activation syndrome has become prevalent, as all my patients' hormones change, and they're mostly women and they're more prone to autoimmune issues. You have to think about whatever you did, and injectables are an implantable thing. And so you have to think about what you're putting in your patients, and fat is your fat. And it's what you're doing is very ethically sound, and I love it. Like I said, I'm going to have to come down. But
I love your description of aesthetics, by the way. Like just the symmetry and the longevity of it and the way you describe it. I thought that was awesome. That was
well,
really
thank
great.
you.
Yeah.
A key point too, like, you keeping things natural. And because I, at one point in time, used to prep a lot of people for bodybuilding shows, mainly women. And so, you could definitely tell when you pull women down to that low of a body fat percentage, you can literally see the implant lining, especially as they start to move. So,
Yeah.
for some women that can be, cause insecurity and stuff like that. But, when you're coming at it from a more natural state, obviously you're not going to see that part. So I think it's a pretty cool procedure. And I think it's definitely one people should definitely be looking into when they're looking into augmentation of either breasts or glutes.
Well, and that
Yeah.
brings me up to a question I wanted to ask you. So, what is your ideal patient? Do you want them to be at the stable weight that they would generally be at? Like, I don't know if a competitor going up and down would be the best once they start to invest into this, but like somebody that's at their goal weight, they're not too overweight, but they're at that perfect body fat percentage. What's your ideal patient body fat percentage or just patient in general?
That's a good question. It's a very visual thing. Body fat percentage is hard to measure accurately.
Mhm.
Yeah.
They have DEXA scans and all that, but that's not realistic. We're not putting everybody through a DEXA scan. And so it's a pinch test, right? And that's what you use. You use calipers. We
That's
don't.
what I
These are
do.
my calipers. These
Yeah.
calipers, man,
That's
they've pinched so much fat in
for
my
sure.
life. Like I'll challenge you. Pull out the calipers and I'll tell you it's crazy.
I'm
Like
I'm
when
there
you've done
with you.
enough of them. So I think, and a good plastic surgeon who's done a lot of this, it's a pinch test and you know it. And then at some point when you've pinched enough and you've seen the pictures before they come in and then pinch them, you start being able to see it in the pictures. Like I don't even,
Hmm.
it's a mental pinch now.
Yep.
And so we do a lot of consultations for people coming in from all over, the country and other countries. And even with pictures, it's rare that we're off. It's rare. It's rare that somebody comes in and we're like, oops, sorry, we thought you'd have enough or you didn't, or you this isn't what I thought, or your skin is looser than I thought. It happens, but it's rare. And so
Right.
is there an exact I think it's a range. I think it depends on the body type. I think it depends on the body shape. It depends on what the person is trying to achieve. Are we just removing a bit? Are we trying to augment the breast and you're very thin and then I need to kind of figure out where I'm going to get the fat that I need? Which surprisingly, even in very petite, thin women, it's incredible how much they're always like, that came out of me. It's always impressive. The first times I would do it, I'd be like, whoa. But when you've seen it a bunch of times, they're impressed, you're not. You know that you're gonna get more than they think. And so I really think it depends on the body type, it depends on the age of the patient, depends on the body shape. It depends on what we're doing with the fat. Are we doing something with the fat or not? I always push to do something with the fat. It's liquid gold.
Well,
Don't throw that stuff out. Don't throw it out.
it's
You
full
get
of
one
stem
shot,
cells. Take it, put it
It's
back,
so
put it in your
good. It's so
face at
good.
least.
It makes the skin better. That's been proven. That
Hmm.
That
started when I was a resident. We started injecting fat into into tissues that were irradiated for cancer.
hmm
So like people would get radiation in their neck or in their breast, and if you've never seen this, what happens to the skin is it becomes like leather, becomes hard. It's even painful to the patients. It's very inflammatory, and some brilliant doctor played around and realized that injecting the person's own fat into those tissues over a few sessions softens it up, reduces the inflammation, makes the calms down that crazy process, because what you're doing is you're bringing in some healthy tissue into an area that didn't have healthy tissue anymore because of the radiation. And so it's magical. And so we know that this fat actually does other stuff too, like rejuvenate skin and just improve the quality of certain tissues. So it's nice. Put that in your breast, put that in your butt, rather than an implant that's even heavier than fat, because it's silicone and it's going to pull down with gravity. I like it. I mean, again, if it didn't make sense to me, I wouldn't do it. I'd be doing
Well,
something else.
it's full of stem cells too. It's just so
Yep.
good for you. And what
Yep.
what do you wish patients would understand before surgery about the role that their lifestyle plays in their results?
Listen, it's, the age old doctor. You walk in and you can't smoke, you can't drink, you can't this, you need to exercise, are you eating enough fiber? Or, like did you put sunscreen? Like the list of like, you can't do anything. And it's tough, you balance, even as a physician, you have to balance life in there, and it's not always easy. I can tell you what's optimal. And so what I try to do with my patients is, and what we try to do is, look, give me 6 weeks, give me 6 weeks of your life. I'm not going to never drink again, never smoke, never nothing, but give me 6 weeks, stop before, put good stuff in your body, be healthy, exercise, sleep early, live a healthy lifestyle, which the truth is almost everybody knows what it is, right? Today, everybody has access to information. Hey, healthy lifestyle. And it comes out. It's almost so accessible that the point is, the reason we're not all doing it perfectly is because it's tough. But If you ask somebody, hey, can you do this for me for 6 weeks? Maybe they won't be perfect, but they're going to do way better than if you say, I need you to do this forever. You know, I have a buddy of mine. We're at the age where you start getting tested for cholesterol. Like thank God everything's good over here. But like my buddy tells me, he's like, I have my cholesterol. They're taking my blood in like 2 weeks, so I stopped eating cheese. I stopped this. I've been on the treadmill every day. I'm like, but like the whole point of that test is to see where you're at, not to trick it by being
Right.
super healthy for a month. So it's just funny. But the truth is, the reason I'm saying that, one, because it's funny, but two, because you actually will see a difference in your labs from 1 month. So
Yeah.
Mhm.
that's what we want for the surgery. I can't ask you to change your life forever, but I can ask you to do it for 4 to 6 weeks, and that will have an impact on your pain tolerance during the procedure. It'll have an impact on your experience. It'll have an impact on how nervous you are the morning of. It'll have an impact on how you feel after the procedure, how you recover from it, how mobile you are, how well you sleep the first few nights. All of those things will, and probably even the final result, to be honest. And things that are sometimes hard to prove, but you kind of have to wonder, if I do everything right just during that time of pre-op and healing, you're going to get better results. You're going to have a better experience. You're going to be healthier. You're going to lower your risks.
Yeah, I think, you nailed it there. 6 weeks is a good enough window of time for them to establish some good habits
Yeah.
that if they start to fall off the wagon a little bit, they're going to start feeling worse. And hopefully that's the catalyst to keep them going.
Yeah.
But also kind of reinforcing the fact of like, you're getting ready to spend quite a bit of money on this. You might as well maximize your ROI on this by taking care of yourself the way you needed to get the desired outcome. I mean,
Yeah.
that's exactly what we preach, with just even with our nutritionists. If you're going to do
Yeah.
6 months of nutrition with us, our goal is to maximize it and get the most ROI out of this, but also establish good patterns and habits so you continue this long term and you don't lose the ROI in a year and you spent the money for nothing.
I love it. I love it. First of all, I need to come and see you. You need to get me into tip-top best shape of my life, and
There
I'm
we
I'm
go.
I'm I'm motivated. So we'll be talking later.
Love
And
to.
second, Jamie, don't tell them that you might create a positive habit that's going to change their life forever. Don't tell them. It's
Yeah,
better if they think it's only 6 weeks.
right.
This is
So,
true.
but yeah, you're so right. You're so right. Creating habits, it starts with a little step, and
Yep.
and sometimes that's all you need, and boom, you change your life forever. But let's start with those 4 to 6 weeks. That's already huge. So,
Correct. Get you great
yeah.
traction.
What
Yeah.
is your favorite thing or what's in your protocol post procedure? Do you guys incorporate lymphatic drainage or anything like that?
You know, the
Peptides.
That's great. Those are great questions. I've started researching peptides. They're not yet FDA approved, but they sound like at least some of them have a lot of potential. And I think research is going to start trickling in, and it's going to start supporting this. And the FDA is always behind. Sometimes the FDA ends up being right. Hey, no, it was a good thing we didn't approve. Sometimes they're wrong, and that's medicine too. We're always a little more conservative, a little bit behind certain things. And then I remember creatine when I was 16, 18 years old. Don't take creatine, you're going to burn your kidneys.
Yeah.
It's terrible. Today they're giving creatine to 80-year-olds because it helps their
Mhm.
cognition and their
Yep.
memory. Like, everybody should be on creatine, right? And
Yeah.
again, unless you have kidney issues, and this is not medical advice to everybody out there. I'm just saying,
Yeah.
like, we get it wrong. We're super conservative. We just want to protect people. And then it turns out, very often, that we were wrong, and that the supplement industry, the bodybuilding world, has been right on so many things. We look at
Right.
protein. Don't eat more than 1 gram of protein per pound, or no, per kilo. Right? It was
Eight.
point
It's
0.9 per kilo, point 0.8,
0.8 kilogram. Yeah. 0.8
point
per
0.8 per
kilogram of
kilo,
body
right? Which
weight.
is
Yeah.
which is like my 10-year-old daughter needs more protein than that,
Yeah.
right?
Yeah.
So, but that's what we thought, and that's what we knew, and that was the best research we had at the time. So I think it's an evolution. We get better at this stuff as we go, and I think the same thing with peptides. As the research trickles in, we're gonna get better at it, and we're gonna start probably recommending it more in a medical way. I think it has huge potential. And to answer your question, I try to only include stuff that I can support with good medical research. And that doesn't mean I'm right. For example, lymphatic massages, I'm kind of on the fence about them. I'm not against them. I don't push them either because they cost money, and I'm waiting constantly for like that good study that comes out that says like huge benefit, especially for the end game or safety, right? Those are the ones that I look for. If you're going to spend money, the person going to spend extra money, I want usually that. But there's tons of amazing uses for lymphatic massages that are proven. It's really
Mhm.
just in the lipo that I'm still waiting for that. But there's a lot of stuff that we put in there, like being active, drinking a lot of water, eating very healthy, upping your protein, which is huge for healing. I'll usually tell people to eat very healthy, maybe add some collagen in there, and
Yep.
just anything that we know is absolutely super safe and has been proven to have benefits.
Yeah, and when you're ready, like we can definitely all help each other with a variety of things because peptides are
Love that.
they are, but it is a gray area, and I get that. And
Yeah.
I understand that where you're coming from because I often thought that the less than desirable outcome that I had, one, I know it was provider, whatever. I'll have you do an assessment, and we can even share it with the listeners. But
For sure.
I thought, okay, maybe lymphatic drainage would be the answer. And then I had another surgeon assess me, and he was like, no, it wouldn't have. So it's just very interesting because those are the things that you see on social media, and then the consumer, even when they come into my practice, has this idea of what's right and what's wrong. And
Yeah.
so I'm glad that you're debunking this and really talking about those trends. Speaking of that, what is one aesthetic myth you wish would disappear?
Oh, that's great. That's great. That's a great question. Um, you know, I think one of the ones that keeps coming back, at least related to what I do, and then we can talk more about these crazy trends that keep coming out every 5 minutes on TikTok, that aren't backed by science, which may be one day, by the way. I always say it with take it with a grain of salt. We don't know yet. But one of them that I always hear is, well, no, well, if you put fat, it it melts away. That a lot of people still to this day, even though we've been doing fat transfers for 20 plus years, and in terms of reconstruction, way longer than that, well, there's still that myth that I'm going to put the fat in. It's only temporary. It's like a filler, right? You can put the filler, it lasts, 6 to 18 months, sometimes 24 months. Now we're hearing studies coming out saying that some fillers last much longer than that, depending on where it's put and all that. So still always learning, but that's a big one. And I'm like, it's crazy that that still is perpetuating because the fat, it's alive, right? Those are your fat cells. And there's a process that's in phases of healing where the fat first lives by something called imbibition, which means the fluid around that just floats around in our tissues. When you cut yourself and bleed, and after it stops bleeding, you get that liquid serum that comes out that's clear, right? That fluid lives in our tissues. And that fluid has nutrients in it. It has oxygen in it. It has everything the tissue needs to live. And so when you inject the fat, it lives from imbibition. And then after about a week, little brand new tiny micro blood vessels start forming and they attach to that fat. And now it's for sure going to survive unless you crush it. It's still fragile. That's why we say don't sit on it, don't crush it, don't smoke, right? All these things, eat healthy, do it right. And then after about a month, those blood vessels are kind of sunk in. It's at that point you have to do it on purpose to try and kill those blood cells and those fat cells. And so that those cells, once they're there, they're yours. They're yours. And fat cells, they can grow or they can shrink depending on how many extra or fewer calories we have, which you guys know very, very well.
Mhm.
So, and that's it. They just follow your body. So whatever shape we create, whatever proportions we create, well, you're going to keep those. You gain, you lose. They're just going to follow the weight gain and the weight loss. But yeah, that's the big one is that fat, whatever stays, which is about 60-70% after the procedure, it's permanent.
Yeah, I'm really glad you brought that up because again, with me prepping people for shows and the fact I've been a personal trainer for 25 years, that's a really common thing I get asked a lot when still training clients, is what is my thoughts on that. And it's like, well, that's not my area of expertise and stuff like that. My goal is squat more, lunge more.
Right.
You'll build the
Yeah.
muscle, but it is good to know
Yeah.
because now I have, answers I can go back to them with and reassure them that is something they seek out. At least I can give them some information to kind of debunk something they might be hearing.
Well, and genetically, some people's like glutes just won't grow, or
Right.
Yeah.
they I mean, literally you can put the fat anywhere. So that's even the face, it's got to go somewhere. But, for somebody that has a smaller glute, like I've been wanting a BBL forever. So, but it's just, I do think that it is definitely still, I even hear peers that say that, and it
Yeah.
is a myth. What is one thing every patient should do before a body procedure? And before you answer that, do you believe in augmenting what you do with things like personal training?
Absolutely. We were even for a while, we were trying to figure out a way to do a partnership with a gym and be like, you get this, it comes with a membership, a few training sessions to get you into it. And it was tricky because everybody we have people coming from all over the place. And so now you have
Hmm.
to try to find a national gym. And then what about people who aren't close to one? And it was just really hard. But we really looked into that because it's so important. I always tell my patients, I'm like, you're gonna do this, it's because you need to change the shape of your body, but the best results you're going to get are going to come from the trifecta of not just this, but super important, if not more important, is your nutrition, because that's your health, and your exercise, because that's your health, right? What we do is going to be a boost in self-confidence. There are some little studies that show that if you take out the fat, it improves like metabolic diseases and stuff like that, because the body doesn't know how you lost the fat. It's less fat. Doesn't, there's many things that the fat does. If you remove it, you get some benefits. But the truth is, you know, eating right, exercising, doing it right, having somebody who can show you how to do the right thing, not get injured, how to push yourself the right way so you're going to get those results. And again, nutrition, you probably agree, is 60 to 80% of that. Sleep, super important. So this is just one cog in that big machine. And that big machine of health, which is mental health, emotional health, physical health, and all of those things combined are, I think, would bring us to where we want to be, which is a state of peace and happiness and comfort and feeling good about ourselves and confidence and self-esteem. But it's a whole. And I think that everybody needs to know how important all of these parts of the puzzle are.
Awesome.
I love it. So if somebody wanted to find you, you have an Instagram page. I believe it's Soft Sculpt, correct?
It's sculpt.
Sculpt. That's
Yeah,
it.
Go. Yep.
SQULPT, sculpt with a Q.
Yep.
That's awesome. And is there
Yeah.
anything that we didn't touch on that you would like the listeners to know about?
I mean, listen, I always say it. And I feel it myself. I'm a dad. I'm a brother. I'm a son. I'm a friend. I'm a boss. I'm a surgeon. I'm just, you have all these roles in life, and we love the people around us, and we take care of the people around us, and we do everything for the people around us, and it feels good. But I think sometimes you have to do a little something for yourself.
Mhm.
And I
I
think
just,
it's okay, to do
yeah,
something for yourself. People
I
should.
say it, I say it all the time. We have to be selfish to be selfless. And,
That's it. Well
taking an
said.
hour or so or out of the day just to be selfish so you can be selfless for the rest of the day. It's
Well
just an
said.
hour. Yep.
I
So,
love
Well,
it.
and even feeling like doing something to boost your confidence. That's the one thing I love about our industry is
yep.
there are things and God bless all these things that we now have, or surgeons like you that are even modifying and improving upon procedures that can help people feel good in their own skin, because when you feel good and you look good, you do good, you're just better, you have better impact on the world, and nobody should feel that way. Like he got a hair transplant this summer, and
Yep.
it's just everybody deserves that, and we have the resources, so why
Right.
not?
I
Right.
agree. I agree. Couldn't
Thank
agree
you.
more. Yes,
Thank
dead
you so
on.
much.
Yep. Thank you
No,
for your
thank you
time today.
guys.
We know you're a busy individual. We really appreciate getting to know what you do more and to get to know you more. So, and like we said, the next time we're down in that Florida area, we'll be looking you up.
Please come on down.
Yeah.
Absolutely. Would love to hang out. And I do want to talk to you because and for everybody to know, I'm going to be speaking to him about working out, training programs, getting in amazing shape, because I think that's super important.
I'll
Thank
get
you.
you taken care of.
We'd be honored to have
Amazing.
you, and
Yes.
maybe we'll be able to come down and I'll be a patient as well. So thank
I'm
you.
here.
Okay.
Have
Thank
a
you both.
great
Thank you
day.
so much. You guys are awesome.
Thank you. You too.
Take care.
Bye.